Hello, in this video I am going to go over the USB 800. So basically highlights things that seem super important to know for the exam. So for hazardous drugs, there's three categories: antioplastics, which is chemotherapy, non-antioplastics, and drugs with reproductive risk. You should know that the National Institute for Occupational Safety and Health, the NOSH, makes the list of hazardous drug. So our USB 800 just tells us how to work with them. Your acronyms, your engineering controls acronyms pretty much have a C in front of them now. So for containment, so it's CPEC, CSEC. I did make a USB 800 FAQ. Check that video out. A lot of these things are repeated, and it highlights the things that are going to be really important. So for sterile and non-sterile hazardous drugs, they can be prepared in the same room, even though it says to have them in separate rooms, if the iOS 7 air is maintained and the hoods are at least 1 meter apart from each other, and there should be no powders done while the sterile preparations are being made. So no non-sterile preparation of powders when the sterile is going on. The CSECs must be negative pressure and have 12 air changes per hour. They should be running at all times if they're used for sterile compounding, just as the other sterile compounding of non-hazardous drugs in the 797. If the non-sterile hood is the only source for negative pressure, it must be on at all times. So that implies that your non-sterile hood could be turned off if it's not the only source of negative pressure. So for chemotherapy, or for making hazardous drugs, you have to be downed appropriately. It's very similar to 797, but in this case you want two shoe covers and 2 chemotherapy gloves. So hazardous drug equipment must be dedicated. The emergency eye washing station should be nearby and available per your OSHA. There should be 12 air changes per hour for non-sterile in the SCECs. iOS 7 air is required for the buffer and ante rooms for the CSECs area with 30 air changes per hour. A segregated compound area would have 12 air changes per hour. So record-wise, employees must have their reassessed and documented each year. They're basically their training. Both men and women with reproductive capabilities must confirm in writing that they know the risk of working with these hazardous drugs. Also, I didn't mention this, but CSTDs are required when compounding is taking place and for administering if the dosage form allows, because they have the pressure equalization, the CSTDs. So, alright. So when receiving the storage of hazardous drugs, you should be wearing gloves. You should be wearing gloves when you're 2 pairs of gloves when you're compounding and when you're cleaning. So 1 for receiving and storage. You should use a face mask with goggles if there's a risk for spills or splashes. Your hazardous drugs should be separated from your non-hazardous drugs once they are unpacked from the receiving area and they are sent to the designated hazardous drug storage area. Spill kits must be in the receiving area in any area where they can happen. So if there's hazardous drugs somewhere, there should be a spill kit. Hazardous drugs cannot be stored on the floor. Hazardous drugs must be stored on shelves, and they must be separated from non-hazardous drugs in an externally ventilated negative pressure room with 12 or more air changes per hour. However, your reproductive risk only drugs and your final dosage forms of hazardous drugs may be stored with other drugs once they're packaged appropriate, basically, in their final dosage forms. So sterile and non-sterile hazardous drugs may be stored together, but drugs for non-sterile compounding should not be stored in areas designated for sterile compounding. This is to minimize traffic for the sterile compounding. So you should refrigerate in a dedicated refrigerator your hazardous drugs in a negative pressure area with at least 12 changes per hour, all the ones that require refrigeration. And in the FAQ they even mentioned you can have both sterile and non-sterile in that fridge, pretty much. Or basically it says antioplastics. You can have your chemotherapy. But definitely check that out. All hazard warnings must be displayed on the containers of drugs. Hazardous drugs cannot be counted with the automatic counting systems, and they should have their dedicated materials that are washed and decontaminated after every use. All the drugs should be labeled with the caution hazardous drug or chemotherapy disposed of properly, something similar. The beyond use date must be on the label. So your chemotherapy gloves, they should be changed every 30 minutes when you're compounding. And your gown should be changed every 2 to 3 hours after a spill, or if your manufacturer suggests otherwise. Chemotherapy gowns are required when administering injectable antioplastic hazardous drugs, so your chemotherapy. The outer chemotherapy gloves are discarded in a yellow trace chemotherapy waste bin, and that's going to be burned. And that's also, so I think it's, you take your gloves off and you handle the hazardous drug, and before you leave this room, you put your gown and your shoe cover also taken off and into that yellow waste bin for burning. Your other things, your bulk chemotherapy waste, so like the IV bags that are empty or unused of hazardous drugs, or syringes or vials, or all these things these are pretty much going in the black container. Don't use the tube system to transport liquid hazardous drugs or chemotherapy drugs. Any areas involved of hazardous drugs must be deactivated, decontaminated, and cleaned. So with deactivated decontamination, you can use the 2% bleach or the peroxide. Be sure to use wet wipes, not spray bottles when cleaning. Your environmental monitoring that we talked about in 797, I believe, should be done every 6 months, similar to that. And if someone is exposed to a hazardous drug, 800 says to remove the contaminated garments from them, wash the exposed area with soap and water, immediately, douse the eyes, as soon as possible if they're exposed, basically, and send them for emergency medical evaluation. And this is the last video on compounding. Thanks. Good luck on your Mpje.